finishing this step. Now we are switching on to the next part of the section, that is the face.
I think so. This is it. Where triangular area is there just about the external castigators and the diagrammatic process.
So before going into the section of the face,
meatal triangle, one should be very clear that supra, what we will do the bones of this region, meatal. If you know the bones of this region, triangle. Then only you can understand what is
just
the
anatomy.
Because of this, which is called supra.
So you have already done the Norma Verticalis and
Meatus
Occipitalis. Now
the
we are
suprameatal
switching on to the
triangle is
next part of the
area
Norma
is a very important
for the ENT subjects. The
frontal
frontal
its importance.
or front part of
Just
the
by
skull.
making a hole in it. So while doing the frontal, the ENT surgeons can go into the
Norma
mastoid
Frontalis. The frontal bone is
for any surgical procedure to remove the pus from the mastoid process. This is the optimal approach, the suprametal triangle, so that is the clinical importance with ENT surgery. So here we see the frontal bone,
because in the
frontal bone
mastoiditis,
is coming
the pus is accumulated in the
and
mastoid and it becomes painful.
coronals.
Itis, red, hot, swelling, everything.
So these are the two parietal
Then
bones.
we have to remove the pus because wherever the pus is there
In the lower part,
by the its nature it tries to
in the
expand.
midline,
So it gives the
on
pain.
either side,
So we have to evacuate it. We have to
there is the
withdraw it.
So we can easily withdraw from the hair. We can make a hole and we can withdraw because it is pneumatic bones. Here is the eyeball is just full with the pockets of the pus. Pus can easily come out through this.
So we'll go into the detail
But
of the orbits.
we go
when we
from
do
the
this.
not from the eye. Because if we draw from
At
here,
present it has got
there
this
will be
middle border,
persistence of the leakage of the pus.
middle border, the greater border and little border. So we never
that is
approach
the
from the floor of
bony
the
orbit,
superior,
mastoid.
medial,
We always
inferior,
go
and
for the
lateral.
roof.
From the
So that is the ENT surgeon
socket for the
lodgement of the eyeball. Then the last part of
just
the
above the orbit.
temporal bone is called the
Pittless
bony
part.
part where the eyebrows are present is raised. So
this
pittless part is
raised
not
part
visible
of
now
the-
because it lies in the inside the
Above
cranial
the
cavity.
superior border
So
of
when
the
we do
orbit
the
is
cranial
called
cavity,
the
then we will.
But at present you should know the word pittless means it is
And it
stony
is
hard.
more prominent in the male skull.
Hard like a rock or the
So this is the feature
hill.
of male skull.
And this is the strongest
In the middle
bone of the
here
skull.
also
It is
the
not
raised
easily
area,
fractured.
a little bit. This is called the another thing about the applied of the Norma Frontalis is that this diagrammatic of frontal suture, this is fronto-maxillary suture, this is the nasofrontal suture.
superior part of the
Almost
orbit
one line.
and got a in its
So in
medial
the
one
car
side has got a
accidents,
knot.
on the face-to-face injury, roadside accident, what happens? The lower part of the face, lower than the in few of the skull and upper the skull is born below the nose, and this nose is maybe converted into a
little bit they are out of
maybe bilateral
touch.
or unilateral. Because all these, when it is converted into foramen, called the supra, the geometry of the, all the future joints is all. And we know what passes through the supraorbital foramen. So lower part of the face
Supraorbital
is going downward in the roadside
Supraorbital
injury.
vein
The upper part of the
and
frontal bone and
supraorbital
whole of the skull
nerve,
remains stationary.
which we have done recently.
Because it is heavy, the nerve supply
lower part
and
of
blood
the
supply
face
of scalp goes downward
front part.
or it is abducted posteriorly.
In
And
living,
this, all
just
these
superior
future
to
joints
the
will be
and
disturbed
the superior the
and there will be
medial
overlapping
part
of
of
the
the
orbit
frontal bone
there
with
lies
the
a fibrous pulley.
facial bones.
Made up of the fibrous tissue,
the nasal as well as the
This
maxilla,
pulley is
so it
called
goes
the
upward.
trochlea.
So there is overlapping. Or in the other one, the face becomes small. It goes up. All of the facial bones will go up. So such a fracture is called the Lee-Ford fracture.
From inside to outside from the orbit by touching this trochlea.
Lee-Ford fracture
Comes out.
and in this
Yeah,
the diabetic bone is also twisted. It goes like this.
And then this one. Now what you will name it? suture line with the temporal bone, it is fixed. Trochlea are the
It won't move because it is attached to the skull bone.
where the trochlea
Or it is
skull
derived
bone
from
remains stationary.
trochlea.
Only the bones of the
Trochlea
face
is
are
medial.
The zygomatic bone is also
Supraorbital foramen is lateral. So this is the mutual position of the supratrochlear and
no doubt that it is lying in the
same line.
the same line fracture is there.
The leaf or fracture have got the different grades also, first, second and third.
Then in between,
Another thing, so
just
this-
below the glabella,
In the lower part is the facial, that is the maxilla. The normal lateral.
below the orbital
Anterior part is
line,
called the maxilla.
the
What is Norma Frontaljs is the lateral surface of the maxilla.
the bony part of the nasal
This one
cavity
is
is
seen
the
in the
surface of
norma.
maxilla.
In the Frontaljs, we see the lateral surface of the maxilla.
And above
This is
here.
the posterior surface of the maxilla.
Two
This
nasal
zygomatic
bones are
arc
present
actually
right and left.
divides the face,
Forming
the
the
part of the face,
bridge
into
of
two
the
parts.
nose.
So they are like the bridge.
Above the zygomatic arc,
Two nasal bone right
below
and
the
left.
zygomatic arc.
They form the bridge.
Above the
This
zygomatic
goes
arc,
like
this
they
area
are
is
not
called
flat.
the
They are
supratemporal
fossa. In
And
Chinese
below
and
the zygomatic
Japanese
arc,
it is
this
flat.
whole area is called the infratemporal
In
fossa.
Europeans, it is very much prominent.
Then, for the
Racial
posterior
difference is there
surface
in
of
the
the
nasal bone pattern.
maxilla bone, there lies two vertical
So in the Indian,
plates.
they are average, not
Bony
flat,
plates, two vertical.
not prominent. Just
So,
behind the maxilla, where
it
the
is
maxilla
midway between them.
posterior surface.
So two
this
nasal bones,
dotted
they
posterior surface
articulate
of the
with the
maxilla is
frontal
also
bone.
called infratemporal surface.
And it is
of the
visible
maxilla.
by a suture
Some
and
called
joint.
infratemporal
This suture
surface of the
is only the
maxilla,
nasal
and
bone.
just behind it there are the two concentric plates. With the one is medial, other is
Frontal
lateral.
bone.
So they call the lateral and medial
called the
pterygoid plates.
Pterygoid.
Frontonasal suture. Lateral and medial pterygoid plates.
Nasal suture.
It is a joint. Like we have done the coronal suture and sacral suture. So all the bones of the skull, they are flat
And in
bones
the
and they are
anterior
having
part of this
sutural
anterior
joints.
border of the lateral and the medial pterygoid plate, these are the posterior
The
border.
lower part of the nasal bones
Posterior border of the medial
is
pterygoid
attached to
plate,
the nasal cavity,
hammer-like
and nasal
projection
projection
in its lower part.
separated into right and
This
left
hammer-like
nasal cavity is
projection
called
is
the
called
nasal
pterygoid
septum.
hamulus.
Nasal septum.
Which is
Pterygoid
the medial
hamulus.
wall of the nasal cavity. This is the lateral wall of the nasal cavity.
And
What is
nasal
the
septum is
pterygoid
seen in
hamulus?
the midline.
This attached is the very important structure that is called the
Medial
pterygomandibular raphe. Then the lateral bone, pterygo or bone of the cheek is called the
Zygomatic. So prominence of the cheek is because of the underlying
Raphe.
zygomatic bone.
which is attached to the mandible. Pterygomandibular raphe. Then in the anterior part of these two pterygoid plates, this zygomatic bone is also, and between the
Articulated with the
infratemporal
frontal
posterior
bone,
surface of the maxilla, there is
to the
light
organ.
gap. They are not fused.
And a joint
With the maxilla posterior surface of the maxilla, they are separated. And there is a gap or fissure is present between the two.
And this fissure between the maxilla and pterygoid plate is called the pterygomaxillary fissure.
Frontal suture. Pterygomaxillary, that is the meeting place of fissure. Frontal
And a
bone
very
is the
important
zygomatic.
structure is present in it, that is called the
Similarly,
pterygopalatine or pterygomaxillary ganglion. Pterygomaxillary ganglion lies on it.
So this is the zygomatic.
So these are the
And
features
laterally,
of
if you
the
trace this zygomatic bone laterally,
so this is the zygomatic
norma,
lateral. So superior attached to the frontal bone, and if you trace it laterally, it forms an arc. This is called the zygomatic arc. So this is the lateral extension of this zygomatic bone, and this zygomatic arc is protective in function. So any lateral injury of the face, the zygomatic arc is so strong that it won't allow the underlying skull to be fractured. So it is curved and convexly laterally present in such a way, so it is a shock absorber in lateral head injuries or facial injuries also. So this is zygomatic arc going laterally. So this is zygomatic bone. Medially, the zygomatic bone is attached or articulate within another main bone of the face. This is the main bone of the face, which is forming the facial structure, and this bone is called maxilla. And maxilla is attached with the 8 teeth on one side. So the lower border of this maxilla bone, this whole bone is dotted one is maxilla bone. So this whole maxilla bone is having in its lower part, teeth are attached in the sockets or the pockets. These pockets, they are called the alveoli. Alveolus, this single, as we have seen in the alveolus in the lungs, so they are also alveoli. So because of these alveoli, the lower border of the maxilla is called the alveolar border. Where to carpet it. So this whole bone is the maxilla. This is the inferior border. We call the alveolar border. So this is the zygomatico-maxillary suture. Then the maxilla bone is also articulate with the nasal, lateral part of nasal bone, so it is called the nasomaxillary suture. Then this maxilla bone is also attached with the frontal bone. It is called the frontomaxillary suture. So these are the joints. So maxilla forms joints with the frontal bone, zygomatic bone, nasal bone, so from all this. And just below this supraorbital notch of the foramen in the maxilla, we also found a larger foramen here, below the orbit. Just at the junction of the medial 1/3 and lateral 2/3 of the lower border of the orbit. Somewhere here, but just in line with the supraorbital. So this is called the infraorbital foramen. Infraorbital foramen. And what passes through comes out through the infraorbital foramen, a very thick nerve. And its starting point or exit point from the infraorbital foramen is like the thick broom-like structure. A bunch of nerve fibers, they are exiting from it, and it is supplying the nearby sensory, the skin over the maxilla and the zygomatic bone. So this nerve which is passing through this is called the infraorbital nerve. Whichever foramens are coming, they are all emissary foramens. They go through and through the skull bones, and every foramen we should know what passes through it. So that will be your viva in the practical. So this is the infraorbital foramen. This is nothing but this is the terminal branch of the maxillary nerve. And maxillary nerve is the branch of fifth nerve, cranium, that is the trigeminal. So here it terminates. And it is sensory. As far as sensory means, it supplies skin of the cheek. Infraorbital. A very large area of the skin is under this supply. And if you put your tip of your little finger just medial, below the medial border, and you trace it 1 centimeter below, and you deeply press it, you will easily find the infraorbital foramen. And if you press the infraorbital foramen for a few seconds, you feel the numbness of the skin over this area. This is the infraorbital foramen. This is just in line with the supraorbital is the infraorbital foramen. Then over this zygomatic bone, there are very minute two foramens are also found. In the zygomatic bone also. One is above and one is below. Very fine. Only tip of your sewing needle can pass through this. So these are mystery foramens. The name of the upper one is called the zygomatico-temporal foramen. And below is called the zygomatico-facial foramen. Zygomatico, upper one is called the zygomatico-temporal and below is called the zygomatico-facial foramen, and same name of the nerve passes through them. So from the above, there passes the zygomatico-temporal nerve and below passes the zygomatico-facial nerve. Both are the branches of maxillary division of the trigeminal, who is terminating as infraorbital nerve. So this is how you remember the foramina in the Norma Frontalis and the structure passing through them. So after doing the Norma Frontalis and the features, now we switch on to the next part of the Norma, that's called the Norma Lateralis, or the lateral view of the skull. So this is the lateral view of the skull, in which all the bones are visible. A new bone is visible here, that is called the temporal bone. Here comes the coronal suture. Laterally you can trace it. This is the same frontozygomatic suture. And behind the bone of the posterior part of the skull is the occipital bone. And this is the lambdoid suture which is coming laterally, meeting with this suture. So these are the sutural bones are present, joints on the Norma Lateralis. New bone is visible here. This is the temporal bone. This is the frontal, this is the nasal, this is the maxillary, this is the zygomatic, this is the parietal, this is the occipital. The temporal bone is lying. And one more bone is visible here. A very small part. Mostly this bone lies intracranially, but a small part comes out. This is called the greater wing of the sphenoid bone. Greater wing of sphenoid bone. Now the temporal bone, it has got 6 parts. Number 1 is the squamous part. As we know, squamous means it is thin, scale-like, transparent. If you see it against this light, you will see the light is coming through. So this is the squamous part of it. So it is thin and liable to be fractured. But because of the Galea aponeurotica attached to the zygomatic arc, temporalis thick muscle covered by temporal fascia, very less plus protected by the zygomatic arc. This squamous part is very least disturbed or the fracture. Because wherever the muscles are attached to the bone, so muscles they act as the shock absorber. So they bear the brunt of the external injury. That's why they are called shock absorber. Otherwise it's very thin and transparent also. That is the squamous part. The next part, just above this, there is a suture between the temporal bone and the parietal. This is called the temporoparietal suture, meeting of the two bones. And over and above this suture is convex upward. There lie two faint lines. On the parietal bone, they are called the superior and the inferior temporal lines. Note it. They are called temporal lines, but they are present on parietal bone. Never make them on the temporal bone. So upper one is called the superior temporal line and inferior temporal line. They are more prominent in the male skull, but they are very less in the. So this is the superior temporal line. This is the inferior temporal line. This is the male skull, so it is visible. Two temporal lines are visible. Then question arises, what attached to them? Superior temporal line, as we know, gives the attachment of the epicranial aponeurosis, Galia aponeurotica. Note down, number one. Number two, temporal fascia. Number two, temporal fascia. So they are also important, like the superior to the highest nuchal lines. The attachment is very, very important. Then comes the inferior temporal line. What is attached to the inferior temporal line is the temporalis muscle. Never confuse. 99% of students fail to answer the attachment of the superior and the inferior temporal line. They reverse it. They always say the temporalis muscle is attached to superior temporal. No. Superior is only made for fish. Number one, Galia, other is temporal. So underline it, remember it. Then the second part of the temporal bone is called the tympanic part. As you know, tympanic means tympanic membrane. So just here, there lies a hole to which the tympanic membrane is attached along the circumference of this hole, and this hole is called external acoustic meatus. External acoustic meatus. Acoustic means related to the audio. In the meatus means small hole. In the anatomy we use the word meatus. A foramen a little bit larger than a foramen. Meatus. Around this external acoustic meatus are the concentric plates of the bones. Thin bones forming an encircle. Concentric. Around this is called the tympanic part of the temporal. External acoustic meatus is also the part of tympanic part of the temporal. So to these tympanic plates is attached the root of our external ear, or the pinna, the root is attached to it. And between the squamous part of the temporal bone and the lower part of the tympanic concentric plate, there lies a fissure. It is called the squamotympanic fissure. Squamotympanic fissure. What is this fissure? So through this fissure passes the, now note down, chorda tympani. Chorda tympani. Only write down the name. The detail we will go later on. Chorda deferens. Then third part of the temporal bone is the styloid part. Styloid part. Just below the tympanic part, there lies the small elevated bone towards the anterior side. This is called the styloid process. Styloid process, and this styloid process is very important. Many structures are attached to it. Number one, write down stylohyoid ligament. Stylohyoid ligament. Number two, stylomandibular ligament. Stylomandibular ligament. Styloglossus muscle. Styloglossus muscle. And stylohyoid muscle also. There is a muscle also whose name is stylohyoid muscle. So it constitutes a styloid apparatus actually. So many structures. So it is attached to the tongue also. It is attached to the hyoid bone also. It is attached to the mandible also. So surrounding structure are there. Sometimes the stylohyoid ligament is ossified, and then the stylohyoid process may be very, very long. When it is very long, in few of these individuals, it is called the eagle's eye. Eagle's eye. Long stylohyoid ligament. Ligament is ossified in few of the individuals. Otherwise, it is only 1.5 centimeter long normally. Then the fourth part is called the mastoid part. So mastoid part is the posterior lower part of the temporal bone. So it is pointed forward and downward directly, and pointed also because of the pointed. It is called mastoid because it looks like resembles the nipple of the female breast. The female breast nipple is called the mastoid. Word is derived from. And mastoid process or mastoid part is the example of pneumatic bone. Pneumatic bone. Pneumo means air is trapped during the development of this bone. So many bones are other are also there which are pneumatic. Out of them, one is this, that is called the mastoid process. Just above the externoclastic meters, the fifth part of the temporal bone goes anteriorly and articulates with the zygomatic bone to form the zygomatic arc. So zygomatic arc is formed by both the zygomatic bone as well as the temporal bone. So from the temporal bone, a projection goes anteriorly and convexly. So this is called the zygomatic process of the temporal bone. Similarly, to meet this, from the zygomatic bone, a temporal process goes backward, and both meet to form a sutural joint that is called the zygomatico-temporal suture, and this completes the zygomatic arc. So, because of this, the fifth part is called the zygomatic part of the temporal bone. Zygomatic part. So the upper border and the lower border of this zygomatic arc. In the lower border, there is a tubercle which is called the articular tubercle. Articular tubercle. And if a tangent is drawn from this superior border of the zygomatic arc, what is drawn? Anybody knows what it? Mathematics? Tangent.